Have you looked at your hands today? Really looked at them? Because right now, while you are reading this, your hands may be sending you a message that your doctor has not yet seen, and that message could be the most important warning of your entire life. Most people look at their hands every single day without realizing that those same hands can reveal what is happening deep inside the body, silently, without pain, without obvious symptoms, and without any prior warning. And the most alarming part is this: the signs are there, they have always been there, but nobody taught us how to read them. If you are over 50 years old, this video is not just important, this video is urgent. Because the 3 warning signs we are going to talk about today are not rare or exotic. They are changes that happen gradually, that many people dismiss as aging, as tiredness, or as just another normal thing that comes with getting older. And that misunderstanding, that simple, common, very human misunderstanding, is exactly what allows certain types of cancer to grow silently for months, sometimes for years, before anyone catches them. So, if you have ever noticed something different about your hands, if your nails have changed shape or color, if your fingers look different than they used to, if your skin has been doing something unusual that you have been meaning to mention to your doctor but keep forgetting, please stay with me. Because what you are about to hear could genuinely change the outcome of your health. And if you find this kind of information valuable, go ahead and like this video right now. It helps us reach more people who need to hear this, and it only takes a second of your time. I am Dr. Emily Reynolds, a specialist in senior health. And for 8 years, I have dedicated my career to helping older adults understand their bodies better, catch problems earlier, and live longer, healthier, and more informed lives. What I'm going to share with you today is not meant to frighten you. It is meant to empower you. Because knowledge, when it arrives in time, is the most powerful medicine there is. Now, before we get into the 3 signs themselves, I want to explain something that most people do not fully understand about how the body works. And once you hear this, everything else will make much more sense. The human body is an extraordinary communication system. Every single organ, every tissue, every cell is constantly sending and receiving information. And when something goes wrong inside, the body does not always announce it with loud, dramatic symptoms right away. Instead, it whispers. It sends small signals through unexpected channels, and the hands are one of the most important of those channels. This is not folklore or alternative medicine. This is grounded in decades of clinical observation and scientific research. The hands are richly supplied with blood vessels, nerves, and lymphatic pathways. They are directly connected to the circulatory system, the lymphatic system, and the peripheral nervous system. That is why changes in the hands can reflect changes in organs that are far away, organs like the lungs, the liver, the stomach, the colon, and even the pancreas. When something disrupts the normal function of those organs, the disruption often leaves a visible trace in the hands, a change in the nails, a difference in the color or texture of the skin, a swelling or a pattern of veins that was not there before. Doctors are trained to look at these signs. But here is something important that I want you to understand. You do not have to wait for a doctor's appointment to begin paying attention. You can start right now. You can look at your own hands with the knowledge I am about to give you, and you can decide for yourself whether it is time to make that call. In just a moment, I am going to walk you through each of the 3 signs in detail. I will explain what they look like, what they mean, which conditions they have been linked to, and exactly what you should do if you notice them. But before I get there, I need to tell you something about why these signs are so often missed. Because understanding that will help you take them more seriously when you see them. We live in a culture where we are taught to normalize discomfort as we age. If something changes, we are often told, or we tell ourselves, that it is just age, just stress, just the weather, just something minor. And for many things, that is actually true. Most changes are benign, but the dangerous ones, the ones that matter, are hiding in plain sight precisely because we have been conditioned to look away from them. Research published by the National Cancer Institute has shown that early detection of cancer can increase survival rates by more than 80% in several types of cancer. 80%. That is not a small number. That is the difference between catching something at stage 1, when it is almost always treatable, and catching it at stage 4, when options become dramatically more limited. And many of those early detections happen not through expensive tests or complicated procedures, but through simple, careful observation of the body's own signals. So the question I want you to sit with for a moment is this: when did you last truly pay attention to your hands? Now let us begin. The first warning sign that doctors pay close attention to is a condition known as digital clubbing. I know that sounds technical, and I want to explain it in a way that is very easy to understand, because once you know what you are looking for, you will be able to spot it immediately. Clubbing refers to a specific change in the shape of the fingertips and nails. Normally, when you look at your finger from the side, the nail sits at a slight upward angle as it grows away from the skin. There is a small visible angle between the nail and the skin at the base of the nail. This is normal. This is what healthy fingers look like. But in clubbing, that angle disappears. The fingertip becomes wider and rounder, almost like a small drumstick or a club, which is where the name comes from. The skin around the base of the nail may look shiny or stretched. The nail itself may start to curve downward over the rounded tip of the finger. In some cases, the nail bed feels soft or slightly spongy when you press on it. Now here is the important part. Clubbing is not painful. It does not itch. It does not cause any discomfort in most cases. It simply changes the appearance of the fingers, slowly, gradually, over weeks and months. And that is exactly why so many people miss it. Why does clubbing happen? The underlying mechanism involves changes in blood flow and tissue growth at the very tips of the fingers. When certain conditions affect the body, particularly conditions involving the lungs, the heart, or the liver, the body begins to respond in ways that alter the circulation and oxygenation of the peripheral tissues, and the fingertips are among the first places where those changes become visible. Multiple studies, including research from major oncology centers in the United Kingdom and the United States, have established a clear association between clubbing and lung cancer. In fact, lung cancer is the single most common malignant cause of clubbing in adults over 50. Other cancers linked to clubbing include lymphoma, which is cancer of the lymphatic system, as well as certain cancers of the gastrointestinal tract, including cancer of the esophagus and the colon. A study conducted at the Royal College of Physicians found that patients who presented with clubbing and had no prior history of lung disease had a statistically significant increased risk of underlying malignancy, and that early investigation in these patients led to earlier diagnosis and substantially better outcomes. Now, I want to be very clear about something. Clubbing can also be caused by non-cancerous conditions, including chronic lung diseases like COPD, heart conditions, and liver disease. So the presence of clubbing does not automatically mean cancer. What it means is that something is happening in the body that requires a doctor's attention. It is a signal, not a sentence. If you notice that your fingertips look rounder or wider than before, if the angle at the base of your nail seems to have flattened out, if your nails seem to curve over the tips of your fingers in a way they did not used to, please do not wait. Please make an appointment with your doctor and specifically mention what you have noticed in your hands. Show them. Point to it. Describe when you first noticed it and whether it has been getting worse. And here is a practical test you can do right now at home. It is called the Chamarot window test, and it is simple and reliable. Hold your 2 index fingers together, nail to nail, with the backs of your fingers facing you. In a normal finger, when you bring the nails together this way, you should see a small diamond-shaped gap of light between the 2 nail bases. That little window of light is normal. If you cannot see any gap at all, if the nails press together completely flat without any space between them, that can be an early indicator of clubbing. This test has been used by clinicians for decades precisely because it is so easy to do and so easy to interpret. If you are watching this right now and you have just done that test and something looked different than you expected, please write the word check in the comments below. I want to know how many of you are seeing something that you had not noticed before. Moving on to the second warning sign, and this one surprises many people when they first hear it because it involves something that most of us have seen on our skin at some point and simply accepted without a second thought. The second sign involves changes in the color, texture, or pattern of the skin on the back of the hands and the area around the knuckles. And specifically, I want to talk about a condition called acanthosis nigricans, as well as a related but distinct condition called tripe palms. Let me describe what these look like, because the names mean very little without a visual description. Acanthosis nigricans appears as darkened, thickened, velvety skin. It tends to develop in the folds and creases of the body, including the knuckles, where it can create a distinctive darkening and roughening of the skin. The texture changes in a way that looks almost like the skin has become slightly raised, with a soft velvety quality that is different from the surrounding skin. The color shift is usually toward brown or grayish brown, and it can develop gradually over months without any pain or itching. Tripe palms, which is a name that refers to the visual similarity of the affected skin to the lining of a cow's stomach, involves a roughening of the skin of the palms that creates an exaggerated ridge and furrow pattern. The lines on the palms become more pronounced, more raised, and the overall texture of the palm looks thickened and unusual. Now, here is what makes both of these conditions significant in the context of cancer detection. Both acanthosis nigricans and tripe palms can be what doctors call perineoplastic syndromes. A perineoplastic syndrome is a group of symptoms or physical changes that occur not because the cancer is physically present in that part of the body, but because the cancer is producing substances, including hormones and proteins, that travel through the bloodstream and cause changes in other tissues far from the original tumor. Research published in the Journal of the American Academy of Dermatology has found that when acanthosis nigricans appears suddenly in an adult, particularly an older adult who does not have a history of obesity or diabetes, which are the most common non-cancerous causes of this condition, there is a significantly elevated risk of internal malignancy. The cancers most frequently associated with this finding include gastric cancer, which is cancer of the stomach, as well as cancers of the lung and the uterus. When tripe palms appear alongside acanthosis nigricans, the association with internal cancer is even stronger. A major review of cases in the British Journal of Dermatology found that in patients presenting with both conditions simultaneously, over 90% had an underlying cancer, most commonly lung cancer or gastric cancer. That is an extraordinary number, and it tells us something very important about how the skin of the hands functions as a window into the internal state of the body. So what should you look for? Run the back of your hand gently across a smooth surface and notice the texture. Look at your knuckles carefully in good light. Is the skin around them noticeably darker than the surrounding area? Does it feel thicker or rougher than it should? Look at the palms of your hands. Do the natural lines of your palms appear more raised, more pronounced, more textured than usual? Has this been getting more noticeable over time? Again, these changes can have other, less serious causes. Hormonal changes, metabolic conditions, and certain medications can all cause similar skin changes. But their sudden or recent appearance in an adult over 50 is always worth discussing with a doctor without delay. If you are finding this information useful and you are learning things today that you genuinely did not know before, this is a great moment to leave a comment below. Tell me, have you ever noticed changes in the skin around your knuckles or palms that you dismissed without asking a doctor? Your experience might help someone else who is reading these comments today. Now, here is something that connects these first two signs in a way that I find particularly important and that most general discussions about hand signs never mention. Both clubbing and skin texture changes can occur together in the same person, and when they do, they reinforce each other as signals that something systemic is happening. The hands are not just showing one isolated problem, they are showing a pattern, and patterns in medicine are more informative than single symptoms. That is why doctors who are trained to examine the hands thoroughly are taught to look at the whole picture: the nails, the fingertips, the skin, the color, the texture, the veins, the joints, all of it together. Because each sign adds information, and together they can tell a story that individual findings might not tell on their own. Before we get to the third and final sign, I want to mention something for those of you who have been paying close attention to this video. If you would like to receive exclusive health content, deeper explanations, and more regular guidance directly related to your health as you age, I invite you to consider becoming a member of this channel. Membership gives you access to content that goes beyond what we can cover in these public videos, and it allows you to be part of a community of people who are serious about taking their health into their own hands. No pun intended. Now, the third warning sign, and I want to tell you this one is the most subtle of the three, and also, in some ways, the most overlooked. Not because it is invisible, but because we have been taught to attribute it to something completely different. The third sign involves the fingernails themselves, specifically changes in their color, and the appearance of what is called the nail bed, which is the skin directly beneath the translucent surface of the nail. There are several specific nail changes that have been scientifically associated with cancer, and I want to walk you through the most important ones so that you can recognize them. The first is called leukonychia, which refers to white discoloration of the nails. There are different types, and not all of them are concerning. Small white spots that appear after minor trauma to the nail are common and usually harmless. But when the white discoloration appears as horizontal white bands that run across the entire nail or as a diffuse whitening of the entire nail bed, this can be associated with conditions involving the liver, the kidneys, or can, in some cases, signal underlying systemic disease, including malignancy. The second nail change to watch for is what doctors call Terry's nails. In this condition, most of the nail appears very pale or white, almost as if there is very little blood flowing beneath it, but there is a narrow band of darker, pinkish brown color at the very tip of the nail. Terry's nails have been associated with liver disease, heart failure, and diabetes, but they have also been documented in cases of underlying cancer, particularly in older adults. They are caused by a reduction in the vascular supply to the nail bed, which reduces the normal pinkish color and creates that characteristic pale appearance with the dark band at the tip. The third, and in some respects the most clinically significant nail change, is called subungual melanoma. This is a type of melanoma, which is a form of skin cancer that grows beneath the nail. It often appears as a dark streak, brown or black in color, running lengthwise down the nail from the base to the tip. This is sometimes called a longitudinal melanonychia. Now, I want to be very careful here because not every dark streak under a nail is a sign of melanoma. Many people, particularly those with darker skin tones, have natural pigmentation in the nail bed that creates a longitudinal stripe. This is entirely normal and is not a cause for concern. However, when a dark streak appears suddenly in someone who did not have it before, when it is getting wider over time, when the edges of the stripe are irregular or blurry rather than well-defined, when it is associated with changes in the skin around the base of the nail, including darkening of the surrounding skin, which is known as the Hutchinson sign, these are warning features that require immediate medical attention. Subungual melanoma accounts for a small but significant proportion of all melanomas, and it is known to be disproportionately more common in adults over 60, making awareness in this age group especially important. The American Academy of Dermatology recommends that any dark streak under the nail that is new, widening, or associated with skin changes should be evaluated by a dermatologist without delay. Because as with all forms of melanoma, and indeed all cancers, early detection is the single most powerful factor in determining the outcome. I want to share something with you now that speaks to why this information matters so much in a practical, real-life sense. Many people I have worked with over the years have told me that they noticed something different about their hands, sometimes months before they were diagnosed with anything, but that they did not mention it at their doctor's visits because they felt it was too small, too vague, or too embarrassing to bring up. They were worried about seeming like hypochondriacs. They did not want to waste the doctor's time. They told themselves it was probably nothing. I understand that feeling. I genuinely do. And I want to address it directly because it matters. You are never wasting a doctor's time by mentioning something you have noticed about your own body. That is precisely what doctors are there for. And the best doctors, the ones who catch things early, are the ones whose patients feel comfortable telling them everything, even the small things, even the things that seem minor. Because sometimes the minor thing is the thread that, when pulled gently and carefully, leads to a diagnosis that saves a life. If you have been nodding along to this video, if you have been thinking of something you have seen on your hands or on the hands of someone you love, this is your sign, and I mean that quite literally, to act on it. Call the doctor, book the appointment, mention your hands, be specific, point to what you have seen, and while you are at it, share this video with someone you care about, your husband, your wife, your sister. Your neighbor who lives alone and maybe does not have anyone reminding them to pay attention to these things. Because the more people who have this knowledge, the more lives can be caught early and the more families can stay together longer. Now I want to bring all three signs together because I think it is important to see them as part of a bigger picture rather than three separate and unrelated things. Clubbing of the fingertips, darkening or textural changes in the skin around the knuckles and palms, and changes in the color or appearance of the nail bed are three different types of signals, but they share something fundamental in common. They are all the result of the body's attempt to communicate what is happening in its interior through its exterior. The hands are visible. They are accessible. They do not require any equipment to examine. They are available to you every single day, completely free of charge. And yet they carry information that, in the right hands and with the right knowledge, can be as telling as a laboratory test. This is not about becoming anxious every time you look at your hands. This is about becoming informed, about building a habit of gentle, regular self observation that is calm, curious, and purposeful. Just as you would notice if your face looked unusually pale or your ankles were swollen, you can learn to notice changes in your hands that fall outside your normal baseline. The baseline is key. You need to know what your hands normally look like so that you can recognize when something has changed. And if you are uncertain, if you genuinely cannot tell whether something looks different or whether it has always been that way, take a photograph, date it. Take another one in 2 or 3 weeks. Compare them. That simple practice has helped many people document changes that turned out to be medically significant. There are a few additional things I want to mention before we close because they connect to this topic in ways that are worth knowing. First, certain medications can cause nail and skin changes that may superficially resemble the signs we have discussed today. Chemotherapy drugs, for example, can cause significant nail discoloration, banding, and even nail loss. Some antibiotics can cause photosensitivity that leads to skin darkening on exposed areas, including the hands. Some blood pressure medications can affect nail color. This is another reason why it is so important to discuss any changes with your doctor, who can help distinguish between medication-related changes and changes that require further investigation. Second, nutritional deficiencies, which are unfortunately more common in older adults than most people realize, can also cause nail and skin changes. Iron deficiency, for example, can cause the nails to become thin, brittle, and concave, a condition called koilonychia or spoon nails. Deficiency in B vitamins can cause discoloration. Zinc deficiency is associated with white spots. These are not cancer signals, but they are health signals and they deserve attention too. Third, and this is important for those of you who care for elderly parents or relatives. Sometimes the person who needs this information most is not able to watch a video like this on their own. They may not use the internet regularly. They may not be tuned into health content. And that means that someone who loves them needs to be their eyes. So if you watch this and you think of an older parent or relative whose hands you have noticed something about, please be the one who says something. Please be the one who says, let me take a look at your hands. Let me go with you to that doctor's appointment. Let me help you describe what you have been noticing. That kind of advocacy, that simple act of attentive love, is one of the most powerful things one human being can do for another. Now, I want to leave you with something that I believe very deeply based on 8 years of working with older adults in clinical settings and in education. The relationship between aging and health does not have to be one of passive surrender to whatever the body decides to do. It can be, and I believe it should be, a relationship of active engagement, of curiosity, of informed attention. The people I have seen come through serious illness with the best outcomes are rarely the ones with the most resources or the most specialists. They are the ones who noticed something early. They are the ones who trusted their own observations enough to act on them. They are the ones who, when their body sent them a signal, chose to listen. Your hands are talking to you. They always have been. The question is whether you are listening. If you have a comment, a question, or a personal experience that relates to anything we have discussed today, please leave it below. Tell me, have you ever noticed a change in your hands or nails that you later found out was connected to something happening in your health? Your story matters, and sharing it here could genuinely be the thing that prompts someone else to make that doctor's appointment they have been putting off. If you found this video helpful, if it gave you something important to think about or act on, please give it a like and share it with someone in your life who might need to hear it. And if you have not yet subscribed to this channel, now is a wonderful time to do so because we cover topics like this regularly, with depth, with care, and with a genuine commitment to helping you and the people you love live longer and healthier lives.